Good evening, everybody, and welcome to the webinar tonight. This is being brought to you by the Nevada Minority Health and Equity Coalition at the UNLV School of Public Health, and we are doing this in coordination with our Northern Nevada chapter of the NAACP partners with the coalition, and this is an effort to bring more information and more resources into Northern Nevada in collaboration with the Nevada Minority Health and Equity Coalition. And so quickly, my name is Jose Melendres, and I am the sitting chair for the coalition and all of our partners. Want to welcome everyone. Tonight's session will be moderated by Ms. Patricia Gallimore from the Northern Nevada NAACP chapter, and Mr. Blake McMorris, who is the chair for our African American Steering Committee of the coalition. Tonight's, and I'll let Blake and Patricia get into more of the details in a little bit, but I just want to share tonight's session is about the incredible work of doulas and their impact in healthcare. And to start off tonight, I just wanted to share a quick story. I'm the father of two incredible young people. They're not longer kids anymore. One's 19 and one's going to be 17. But both of them were brought into this world with the assistance, support, and coaching of doulas. And so my family has personal experience with the incredible work and the incredible people that doulas are. I hold them in very high regard for what at one point was a very scary situation, but they were able to, in my part of it, they were able to coach me through it, and was an incredible experience with the birth of my daughter and then the birth of my son. So I will forever hold a special place in my heart for what doulas do and the work and the impact that they do in our world. So with that, thank you everybody for joining us tonight. And I want to thank our staff, Brian, Gabriela, Megan, for supporting this work and doing all the work to bring all this together. And with that, I will turn it over to Patricia and to Blake. Thank you.
Okay, well, thank you very much, Jose. As Jose indicated, my name is Blake McMorris. I'm the co-chair of the African American Steering Committee for the Nevada Minority Health and Equity Coalition. And I want to thank everyone for attending. This is part of our Amplifying Equity series, and our focus tonight is on, strengthening maternal health and the value of doulas during pregnancy and postpartum. I am so excited about this because statistics have shown that Black women die at 3 to 4 times the rate of whites. I think that knowing more about doulas will only serve to improve those outcomes. So I just want to thank you for that. But without further ado, though, I want to introduce you to my co-host, my fellow moderator, Patricia Gallimore of the Reno Sparks NAACP.
Hi, good evening, everyone. Thank you so much for being here. This is really, really exciting for Northern Nevada, for me especially. I am the current president of the Reno Sparks NAACP, as well as I am the co-chair of the Health Committee. Our chairperson is actually Janet Serial. Also, just here very recently, going down to Las Vegas. I just got back from there from National Convention for the NAACP, and I was appointed to the board of directors. So I am now a national board director for the NAACP, sitting along with probably about 63 other people as well. But just as my co-host was saying, Blake was saying, it's very, very important. This is one of our series. This is the first in a series in terms of what we're going to be trying to do in Northern Nevada, just bringing more awareness to the population here in Reno, Sparks, Washoe County, Northern Nevada, that, Nevada Minority Health and Equity does exist, as well as we have a wide range of different things that we're talking about. So this is the first in our series, and so we're doing it as a webinar. At some point, we'd like to extend this to something in person. So with no further ado here, without further ado, let's get this started tonight. Thank you all for being here this evening.
Okay, now before we move to our presenters, I just want to go through a few housekeeping items. Please keep your telephones on mute. If you have any questions, use the chat. We're going to have a survey at the end of the presentation, so please be sure to give us information on how well we're doing through that survey. So, Patricia, I'm sorry for jumping in on you, but I just had to add that in.
That is so perfect. Thank you so much for doing that. I appreciate that. That's what I did. I didn't write it down, but that's what we needed to say as well. All righty. So go ahead if you want to go ahead and introduce our speakers this evening too, Blake. That's fine. I'm okay with that.
All right. First, we have Jennifer Campbell and Tiara Flynn, both doulas, both with a wealth of experience. And along with them, we have Vicki Ives from the state of Nevada, who is going to provide us with real data on the state of maternal health in the state of Nevada. So let me move forward and say again, thank you all for being here.
Yes. All right. So who wants to go first? They'll be discussing what is a doula.
Next
And
slide, please. That's
yep,
me.
there you go.
I'm
That's you.
ready.
Thank you.
So this is us, Tiara and myself. I'm Jennifer Campbell. I'm a birth doula. I also have special certifications in bereavement, adoption, and surrogacy. I'm a certified lactation educator and childbirth educator, mom of 18. We can talk about that on another webinar. Next slide. Actually, Tiara, why don't you jump in and introduce yourself now?
Well, I'm not following that. My name is Tiara Flynn. I'm a full spectrum doula, which means I support moms through the full reproductive spectrum of, for the full reproductive spectrum. I am a mother of only 2, unless you count my dogs, so 4.
Next slide, please. The word doula comes from ancient Greek, meaning woman who serves. Quite literally, a doula hired for your birth is there to serve the mother, her partner, and support her in any way she can. Doulas provide emotional, physical, and educational support to pregnant women. Unlike medical professionals, doulas do not perform clinical tasks, but focus on the overall well-being of the mother, offering personalized care and comfort measures. Next slide. There are lots of different types of doulas. Birth doula is where most training is geared, helping women who are pregnant. Services begin during pregnancy and extend to the first weeks after delivery. Medicaid carries this service for 90 days postpartum. I also want to point out that when we get called to a labor, we do not take shifts. The longest labor to date that I've been physically present and invested in is 46.5 hours. So we take cat naps and sleep when we can. The other most popular doula is a postpartum doula. Although this is partially covered with a birth doula, it's also separate for families who want to hire someone on a regular basis, including overnight to help transition with the baby. But there are many specialties. I mentioned that I do bereavement, adoption, and surrogacy. There's end-of-life doulas, death doulas, lots of different kinds. Someone recently told me that they think that they should start a divorce doula. I mean, it's helping women in transition, so nothing wrong with that. Next slide.
Yes, so as Jen stated, there's different variations in which you can become a doula or you can hire a doula if you're a family that's seeking support. The Doula Co-op of Nevada, previously known as the Doula Co-op of Reno, is an organization, is a nonprofit organization that is basically the link between doulas and the underserved families here in our state. Through support, education, and advocacy, we empower doulas across Nevada to enhance their care and make a lasting impact on the communities that they serve. So basically, we provide skill sharing, workshops, a network for doulas to connect with one another, collaborate, and just all around full support for the doulas so that way they can support the families. Next slide, please. A little bit more about the Doula Co-op, like as I mentioned, previously known as the Doula Co-op of Reno, and we recently expanded statewide so that we can truly live and walk in what we taught. So at the top of this year, we expanded to the Doula Co-op of Nevada. Yours truly was appointed as the president of Southern Nevada. We also have some amazing programs that have already been implemented and that are in the pipeline. One that I want to point out is the Doula Access Program. Up there in Reno at Renown Hospital, doulas have access and a connection with the nursing program to be able to really provide families and mothers with the full continuity of care. So what I mean by that is doulas have access to actually go into the operating room, which previously we did not. So that was a huge win, is a huge win for us as the Doula Co-op, and we're hoping to duplicate those efforts throughout the state. We also recently established within the last year a rockstar board of directors that is fully included of doulas of all ranges. We've also expanded our reach to death doulas. So as Jen mentioned earlier, there's various ways in which you can become a doula and that you can provide families with that type of care. And we learned through some of the doulas in the Reno area and statewide that that was a need for families. We also were instrumental in the fight to get Medicaid access for doulas. So now doulas can be Medicaid providers. Jen is the pioneer and the very first one to make it fully through the process. So we thank her for being our guinea pig in that regard, among many other things. And we're just getting started 2 years in. Next slide, please. Before Jen and I get into the details of the scope of practice and the doula experience, you're going to hear now from Vicki Ives, who's going to talk a lot more about what Blake mentioned earlier, which is the disparities in maternal care and specifically Black maternal health here in the state.
Thank you so much. My name is Vicki Ives. I work with the Division of Public and Behavioral Health and serve as the Bureau Chief for Child, Family, and Community Wellness, which includes immunizations, WIC, chronic disease, and maternal, child, and adolescent health. So today I'd like to just tie in some of the data that we have at the state level that relates to doulas who, from a public health lens, are seen as an evidence-based practice in helping to reduce maternal mortality and severe maternal morbidity. So the data might just kind of frame the issue here in Nevada, as well as talk a little bit about some of the recommendations that have come out of the Maternal Mortality Review Committee and about the role of the Nevada Office of Minority Health and Equities Advisory Committee in making recommendations to policy leaders in the state. So I hope that information will be useful. So as you can see, this is more information than maybe we'll be going into this evening, but it'll be a resource and always happy to connect if anyone wants to follow up for more information. But in looking at maternal mortality in Nevada, we have had a maternal mortality review committee established since about 2020. So we're fairly new, and we have some other programs that exist really just to end preventable maternal mortality and preventable severe maternal morbidity. It's really key to note that 8 out of 10 pregnancy-related deaths are preventable in the United States, 8 out of 10. So there's really a wide scope of areas to make an impact. Another key factor that Blake had mentioned earlier is the marked disparity in maternal mortality as to where that burden is falling. We see in Nevada, around the middle of this slide, you can see that for people who are African American or Black and non-Hispanic, they have a 4 times higher rate of pregnancy-related death than white non-Hispanic people and Hispanic people. So it's a huge, huge disparity. And then I'll show briefly a different graphic in just a moment that looks at how that can differ between types of maternal deaths. So at the top of this infographic, you can see there's different buckets of how maternal mortality is viewed. And there's pregnancy associated. So that's the death of a person while pregnant or within a year of the end of pregnancy from any cause, regardless of the cause. Then there's pregnancy-related death over that same time period where it's really it's aggravated by or caused by pregnancy and the death. And then there's a subset of maternal death, which is within 42 days. So you can see right below that, there's a little graphic with a family that in Nevada, we're really seeing most of our pregnancy-associated deaths, not during pregnancy, which is about 18% of deaths, but in the postpartum period for that 0 to 42 days, that maternal death period, and largely 58% in that postpartum period from 43 days to 365 days. So when we look at causes, it can vary by the during pregnancy, early postpartum or late postpartum periods, and also by those two types, pregnancy associated and pregnancy related deaths. We see some variation on leading causes. Some of the leading causes of the pregnancy related deaths are related to, cardiovascular health, and infection. When we look at pregnancy associated deaths, we see quite a large burden related to substance use and overdose and suicide. So there can be variable causes depending on which type that you're looking at. There can also be different burdens. We see a higher disparity rate for Indigenous persons that are American Indian, Alaska Native for pregnancy associated deaths. And we can see some variation geographically too in leading causes of death. You'll see here Clark County has almost a 4 times higher pregnancy related death rate than Washoe County as well. So what some of the efforts that are going into preventing maternal mortality include this Maternal Mortality Review Committee, which creates a report that goes to the legislature every 2 years. And legislation was created to ensure that the Maternal Mortality Review Committee also gets recommendations from the Nevada Office of Minority Health and Equities Advisory Committee, who also contribute recommendations. So in terms of the process, the summary data is shared with the NOMI Advisory Committee, and then their recommendations are part of this legislative facing report that focuses on, how can we end preventable maternal mortality, and then, near misses or severe maternal morbidity are some really key areas. And if you don't mind switching to the bar graph slide real quickly, thank you so much. Just wanted to draw your attention, I know this is a busy slide, but to the pregnancy associated deaths and pregnancy related deaths graphs in the upper left corner. And it just illustrates in a different way that we see different patterns of disparity when we look at those two different types of maternal mortality, with a huge disparity for American Indian, Alaska Native on the pregnancy associated deaths, and then pregnancy related deaths for African American Black populations when compared across other race and ethnic groups. And then there's some other data that also highlights disparities along both maternal mortality and infant mortality. And then briefly in the lower corner, you can see a very different mix in payment source when you look across race and ethnicity, with the Medicaid coverage among African American or Black populations. When you compare that with white and Asian, you see a very different pattern. And if we could go back to the other infographic, please. Thank you. And then maybe to the second page of that, if you don't mind scrolling down. I so appreciate you driving on this. Thank you. So just in looking briefly at some of the recommendations from that report that both the Maternal Mortality Review Committee and the Advisory Committee of NOMI have shared, you can see that some of them explicitly call out the role of doula. If you look at item 2, focused on providing access to quality health care, ensuring widespread use of doulas is highlighted as part of a suite of access enabling efforts, including transportation supports, engaging with community health workers, home visitors, peer counseling, behavioral health peer supports, to really wrap around the pregnant person and their family to ensure that they can access the care they need. As well as some of the other recommendations. There's some really nice tie-ins, since the focus is on the importance and the benefits of doulas in reducing maternal mortality and just improving birth outcomes. So when you look at the social determinants of health, some of the opportunities for referrals and connections to different programs that can help with social determinants of health. That's another touch point. That recommendations are really span, a wide range of topics. Some are very clinical in focus and protocol related, to ones that are really high level. The role of adverse childhood experiences, for example, has come up quite a bit in looking at upstream interventions in order to decrease maternal mortality burden. If you look, some of these focus on expanded protections. Some have touch points with our law enforcement, with mental health systems. Some are specific to Medicaid, as well as some clinical interventions as well. But I'm hoping the takeaway here is the preventability of most maternal deaths, the marked disparity in burden, and the need to include equity in any framing or programming to address maternal mortality and severe maternal morbidity. The role of the NOMI Advisory Committee, as well as the Maternal Mortality Review Committee, in being able to uplift recommendations that can make a difference in ending maternal mortality, and then just a sense of how our state's data looks, in case that's helpful in the coming discussion. So I really appreciate your time this evening, and I'd like to turn it back over to Ms. Tiara Flynn. Thank you.
You're actually stuck with me first. And Vicki shared a lot of stats that are really scary, and those are incredibly important. One of doula's main focus is generally education, and this definitely falls under the education that we need to have. Like she said, 8 out of 10 deaths are preventable. That's massive. So looking at this information is vital. I'm going to switch it up though and say something happy, because first, look how cute we are. Also, that picture on the left, that is me being a doula to my 28-year-old daughter. She lives in Arizona, and we decided she would go into labor and I would drive 14.5 hours. And I got a certain distance and I thought, she had better not have this baby, because I am on my way. And I got there just over an hour before she had the baby. So I was able to be her doula through transition and delivery. And it was pretty amazing. I'm going to talk about the scope of practice. A doula's scope of practice is unregulated, meaning there's no governing institution that tells doulas exactly how to operate. Although most doulas work in community, like we talked about the Doula Co-op of Nevada, or follow an unofficial code of conduct, typically based on their training organizations. The scope of practice is complex and multifaceted, encompassing continuous emotional, physical, and informational, educational support throughout the entire reproductive spectrum. Doulas need to navigate the nuances of advocating for their clients' needs and preferences within the medical settings, all while respecting diverse cultural practices and individual circumstances. They provide tailored comfort measures and educate clients on various options. Next slide. Here are the do's and don'ts. It's really obvious. And the biggest thing is that I can't stress enough, we are non-medical providers. We're not going to do anything that your doctor would do for you or your midwife. I often get text messages or calls from clients asking me, like, what should I do about this? My answer is you should call your medical provider. We stay in our lane. We do a lot to provide support and guidance before, during, and after labor. We help with the birth plan. We assist you with comfort measures. I'll talk about that in a little bit. And we support you during the immediate postpartum period with in-home visits, but we are non-medical providers. Next slide. Comfort measures can include massage, touch, position, and movement. That one is key and huge in labor and delivery. Breathing techniques, hydrotherapy, rebozo. You can see Tiara doing a rebozo technique there. Partner involvement is really key. When a woman has a partner, that person is basically on the team with me to support the woman in labor. And then the doula can also help bridge the gap to the medical professionals. And then we also do lighting and sound therapy. I bring a TENS unit. I've got unscented massage oil. We all have a birth kit full of all kinds of different things to help our mamas get through their labor and delivery. Next slide.
Yes, thank you, Jen. And if they're there with a husband, I definitely make them do all the work. No, I'm just kidding. As Jen mentioned, we are the non-medical support side of your care. And so I want to highlight specifically talking about how we help you advocate. We don't speak on behalf of you, and we don't relegate your partner or your other support person to a third-party role. We're really here to help you advocate and educate you on how to do that. So doulas, of course, play a crucial role in empowering you to advocate for yourselves, not only during pregnancy, but in the postpartum period as well. As Vicki mentioned, some of those statistics earlier being preventable, a lot of the outcomes, a big part of it is communication and feeling confident and secure enough to communicate with your medical provider. And when doulas are helping you to advocate for yourself, we're also assisting you in developing a sense of autonomy and confidence. So we want you to communicate your preferences and your concerns effectively. I often at my prenatal appointments will ask my clients, before we leave this session, do you have a list of questions that you want me to help talk through? Do you want me to help you? Do you want to kind of role play? So that way, when you have your appointment with your care provider, you feel a little bit more confident and comfortable in these questions. Really, this happens in a couple of steps from my viewpoint. So step one is educating. We talk to you about the different ways in which you're able to deliver or give birth. And that way you can go in and ask your doctor the question, is this a possibility? Is this a reality for me? Because as Jen mentioned, we may help you put together that birth plan, but your primary care provider, your OBGYN, your midwife knows your history, your medical history, so they can tell you this isn't a possibility because of X, Y, and Z. And then you can potentially come back to your doula and ask how we can curate some follow-up questions. Next, like I said, is in the empowerment. So we really focus a lot of energy on empowering not just our birthing person, our mothers, but also empowering the people that are going to be in that room. I like to tell my clients flat out and keep it real with them and say, if anybody's in that room with you, they need to be a part of your birth team. So if your cousin wants to be there, your sister-in-law, your mother-in-law, let them know that this is not a spectator sport. And they're a part of the team. They're either there to do massage and help with comfort measures, or they're there to help you advocate. One way to, and we empower our families and our clients to advocate for themselves is not by making sure that they understand that this is not a confrontational aspect, right? We want to make sure that you're building a healthy relationship and a continued relationship with your medical providers and your care team. And this includes nurses as well. And then lastly, just supporting you. Again, we're here to support you in the background. We're here to help you come up with a plan. And if your plan doesn't go according to plan, because babies do what they want, we're here to help you navigate what that looks like as well. In the event that rights have been violated, or if you feel like your care was mishandled, we also help you to curate complaint letters and so on and so forth. But we hope we don't get to that point. Next slide. So a question that we often get is, what's the difference between my doula, my midwife, or how do I navigate all of that? As Jen mentioned earlier, we stay within our scope of practice and we make sure that we're not stepping on anybody's toes. Everybody here is working as a team, as a unit to support you as you go through this journey. It's important to understand that your doula is not the same as your midwife or your OBGYN. We have to stress that as much as possible. Doulas are non-medical providers. So we're here to help offer that educational, physical, and emotional support, but also to help you foster these relationships and develop them into healthy avenues. Doulas provide your family as well with that same support, not only through birth, but in the immediate postpartum period. The significant difference between a midwife and a doula is that midwives provide medical care the same as your OBGYN would, and your doulas do not. We also get the question of what's the difference between my midwife and my OBGYN? Do I need both? It's really up to you how you develop your care team. But I like to describe it in plain terms as your midwife can do everything that your OBGYN can except for perform surgery. And then you have the right to choose and remove people from your team. That's a huge part of us communicating that in the prenatal appointments with our families. You have the right to remove anybody from that room, from your care team at any moment during this process. Next slide. Oh, and I'm sorry, can you go back one more? I'm sorry. I do want to highlight that nurses are a huge part of your care team as well, and then additional support resources. So therapists, lactation consultants. Again, this is something that doulas are kind of like your informational hub. So the longer we've been in it, the greater our resource list grows. It's forever growing. A lot of us start out with this very basic list, but we eventually establish it into something great for our clients. Thank you. Next slide. So how do you find and access your doula, and what's availability like? So as Jen mentioned earlier, we are not a regulated profession. So a lot of us operate as individual business owners, and we create our own schedule. So availability is really based on who your doula is. And that's a good question for you to ask them in the interview process. So the way to access doulas, a great way, as we mentioned earlier, the Doula Co-op of Nevada has a resource page, and they have a button right there that says find your doula. So you're able to at least start with that list there. But another way is to utilize social media. Go on Facebook, go on Google and search doulas Las Vegas, doulas Nevada, doulas Reno, and you'll find quite a bit. I always recommend to my families, even while they're interviewing, at the end of them interviewing me, make sure you at least interview at least 2 more. Even though I know you love me, I know you're going to work with me, interview at least 2 to 3. And then as far as availability, again, that depends on your doula. So Jen mentioned earlier, like, we don't really take shifts, and we operate on our own, but doulas also work in a backup system between us. So we know who's available when. We're very aware of what each other has going on, and we work well in community together. Next slide.
Are doulas covered by insurance? The short answer is that depends. Tierra shouted me out, which I love. I was the first doula in the state of Nevada to become a Medicaid provider, and we have many more now. So yes, thanks to the Doula Co-op of Nevada for going through the legislation process over a year ago now that raised the living wage to basically almost the same amount that I got from self-pay clients. We are now Medicaid providers. We're going to give you contact information for this too in a bit. I'm also one of 2 TRICARE providers in Northern Nevada. I'm the only one in Reno. I was a military dependent, and it's part of my heart to serve people in the military. Other insurance companies may accept doulas and reimburse you for at least part of the amount that you are charged. I have a packet that I give to my clients to submit services to their insurance company in the hopes that they're reimbursed, even in part. I'm paid by the client, and I do my part in helping them with this reimbursement. Availability, Tiara already covered that mostly. It varies from doula to doula. We all determine how many clients we can take each month, what types of clients, and I do the same thing that Tiara does. And we're a very close-knit, not competitive group of doulas in the state. And so if I meet with somebody that I really feel is a better fit for someone else, I will let them know I'm happy to be your doula, but I really want you to meet with this doula because I think that you'll click. So next slide. And connecting with us. So you can connect with Tiara or myself, but here's the doula co-op. There are 2 links that I think are some of the most important. There's a ton of comprehensive information on the website, but one is to find a doula. This is assuming that you are not you do not have Medicaid, you have some other insurance or you're self-paid. And the second link is specifically Medicaid doulas. And the Doula Co-op of Nevada has done a great job of listing all of us out. You can see our profiles, do a little cyber stalking, interview us, all that stuff.
I want to add to the access part, Jen, that another question that, and I know we're going to go into Q&A, but another question that we get a lot is, are doulas affordable to me? How am I able to pay for this if I can't be covered or if I don't have insurance? And a recommendation that I love to give out is do a birth fund for your baby shower, right? Like maybe someone came in with this beautiful, lovely basket and in the moment they were memorable, but guess what? If you paid for their doula as a friend, that's the best gift you can give a mom and a family. So I just wanted to add that. And we are at Q&A.
All right, folks. Do we have any questions that we need to ask of the folks that we're discussing, the doulas, this evening?
Someone asked, what is IBCLC, International Board of Lactation Consultants? I was one. So I'm a certified lactation educator. I can help with some breastfeeding. I can teach classes. I'm limited to what I can do. A lactation consultant can do a lot more and they can bill for Medicaid. So I have my lactation consultants that I refer to that are Medicaid providers and non-Medicaid providers, depending on what kind of insurance that the client has.
I had a quick question. I actually had 2 questions. Because you brought up a good point about having like your family there as your advocates and as a support. And so I was just wondering if any doulas like in the co-op, like are there bilingual doulas? Do you have any Spanish speaking doulas?
We do not, unfortunately. It's one of the things that we are I want to learn Spanish so bad, you guys. You want to help teach me Spanish? I am there. I'm down for that. But we don't. And that's something that there is a scholarship that just went out. We are looking for that. Emily Barney is here in the audience. She just posted something. So now I'm being creepy. She's the executive director and she raised her hand. So she can probably answer that for you.
I was going to say there's some in the queue, but I know Emily has a better answer than that.
Well, I certainly am not here to take any of the stage because Jen and Tiara got this, but this is a question that I do have more just experience in answering more directly because of the scholarship and the research. I jumped on a couple minutes late, and so I'm not sure if research got touched on. It didn't. Okay.
No, it didn't. Yeah. Thank you for that.
Well, that is going to be another webinar. So we will go into that. But the bilingual doulas, Spanish speaking doulas is the biggest need right now for, not right now, just a moment, please. In Northern Nevada and in Southern Nevada, but Northern Nevada specifically, we know that this is a need that, sorry. We know that this is a need. And so our scholarship was looking specifically for this, and we were able to award scholarships to 10 individuals. One of them is a Spanish speaking woman here from Northern Nevada. Another one speaks Russian. We have another doula in Northern Nevada speaking Igbo, who is a Nigerian language. And then another doula who is bilingual in English, trilingual in English, Spanish, and French. Some of you might know her as Joyce Abang, if you are familiar with that name from Nomi. So she was going to be here. So we're working on it is the short answer. We're getting them trained, and more to come on that with an upcoming doula scholarship through some different federal funding mechanisms and the Workforce Development Board.
Thank you, Emily.
Also, I need lessons still. Somebody
Yeah.
needs to give lessons. Yeah.
Yes, we awarded 10. And like Jen said, I mean, I've been trying my hardest to learn Spanish, but I don't know. I don't think it's gonna happen. 20 years ago in high school, and then shortly after while I was in the Air Force, it's just not sticking. So I'd rather let the pros handle it. Do we have any more in the chat? I'm scrolling quickly. How can we learn how to find out more information? Yes, thank you for the question, Hazel. As Emily put, that's a good start. But like I was saying, social media for sure. And then make sure you do those interviews. Just make sure you interview.
There's a question about the earning potential for a doula, and that varies pretty wildly. I'm a full-time doula. That doesn't mean that we aren't spread doing lots of other things other than just birth work. I like to take 4 clients a month, and that's 4 to 6 is super full-time. I just had 6 in 5 weeks, and it's pretty intense because you're there for every single birth. So I did 4 deliveries in less than a week. And, you know, like I slept 7 hours in 72 hours, basically. It's not just the prenatal and the postpartum appointments. You're actually physically there for the birth. So we're limited in how many clients we can take.
Yeah.
We do, as far as what we get paid, Medicaid pays $100 for each visit, and there are 4 approved, and then $900 for a birth, which is $1,300 total if you're doing the math. When I take a self-pay client, I charge $1,500. So you can make 3 $500 payments, or if my clients pay me up front, I give a 10% discount and it comes to $1,350. I've only had one person not pay the full amount. So basically I'm getting $1,300 from Medicaid or $1,350 from a self-pay client. The difference is self-pay pays on the front end, and Medicaid we have to bill on the back end. So that's the difference, if that answers your question.
I don't have anything to add. Jen is super doula. Okay, 6 in 5 weeks is a lot. So there was another question. I lost it. Oh, somebody.
Yeah.
So how is the
Blake.
pregnancy related death rate for Black women being addressed? In various ways. I mean, as Vicki mentioned earlier, we now have the report and we have the numbers to be able to address this. But then I still think that there could be a whole lot more done by creating kind of like these other subcommittees, right? Or like task force, for lack of a better term, to work on this specifically. Personally and professionally, I've seen that a huge part of it is in the communications, and then the communication of care. And that's where that preventable aspect comes into play. I've put a great deal of my practice and focus into that because being a Black woman, it's really, you know, important to me. And I personally have had a handful of situations, I won't call them cases, I guess, because it's not like anything legal happening, but like situations where I've, you know, had to strongly advocate in the background for my client to kind of turn things around before they got to that point. So I just think that there could be more done in the hospital settings because that's where it's occurring, obviously. And I do think a huge part of it is communication, like just simply listening to, if you watch a lot of these stories, if you talk to a lot of families who unfortunately lost a loved one due to a pregnancy related death, or like in care, they will tell you like that the pregnant person knew that something was wrong and they just weren't listening to them. So that's a huge part of it. It sounds really simple, and I don't want to, you know, make it sound like it's so easy or downplay it, but a huge part of it is communication. So we're raising awareness throughout the state. Like I said, through various events. I spearheaded this year. We've done a lot over the years during Black Maternal Health Week, which occurs in April. Usually April 11th through the 17th, but I spearheaded this year. I feel like one of the larger ones that we've seen, and we're going to continue to do a whole lot more. So,
yeah, thank you for that response. And And let me just dovetail on your response and ask, what can organizations such as our coalition do to improve these outcomes?
Yeah. One, and I don't know if I'm in control over saying this, but to support organizations like the co-op. We're not here pushing the co-op, I promise. But I'm saying that because we are, a big focus of ours in the next coming years is to build the doula workforce. And I love that we got the question about Spanish speaking, because another huge goal of ours is to have more Black doulas and more Black care providers. The statistics have shown us that sometimes families, or oftentimes families, feel a lot more comfortable in care of somebody that looks like them, that resonates with them, that understands them as a person, as a Black person. And so a huge part of our focus in the next year, 3 years, and coming forward is to build that pipeline of Black doulas, but also culturally congruent doulas, because just because your doula is, white or Hispanic or otherwise, that doesn't mean that they can't care for you as a Black woman. I'm going to shout Jen out again, because we recently did some testimonial videos up north, and she had a mom expressing to us that she felt like if she didn't have Jen by her side, nobody would listen to her as a Black woman specifically. She just felt like she felt safe and she felt secure. So when a doula is experienced and they go through the various trainings and they have extensive experience like Jen does, but also go through those trainings to learn these things, which I know a lot of the doulas in the doula co-op have done, they can support you as well. So I just want to make sure.
I felt worried, concerned that women of color would not be as comfortable with me. And that's interesting. I'm the only doula in Northern Nevada right now that's in the jail, domestic violence and substance disorder. And I have never personally been in jail, an adult domestic violence situation or a substance disorder. And yet I'm still able to learn enough to support them. And I feel like it's very similar. Let me tell you, nobody in that hospital is going to throw down more than I am. If one of my mamas is, and it's happened. The biggest situation that I had was someone who was Native and in step 2. And I don't generally show up at the hospital postpartum, but I sure did with her. So we don't advocate in a confrontational way, but we are very present for our clients. And I think it makes a significant difference in their care.
For sure. And sometimes you have to assert that presence, for sure. So thank you for that question, Blake. Like I said, supporting organizations like the co-op and others that are trying to build up this doula workforce, right? And build up this culturally congruent, this competent doula workforce, so that we can make that available for families in Nevada, and specifically for Black mothers.
I would add too that just some efforts at the state level, in addition to the Alliance for Innovation on Maternal Health patient safety bundles. So severe hypertension, the next one will be obstetric hemorrhage. There are leading causes for Black non-Hispanic people, such as hypertensive disorders of pregnancy and cardiomyopathy, that may be different from other groups. So ensuring we're disaggregating that data so that there can be focused programming on top reasons for death across different groups. And also we were one of the very first states to help enhance the work of the Maternal Mortality Review Committee by including MSWs to do interviews with survivors of maternal mortality, with that goal explicitly of being able to parse out, elements like, racism and treatment, or to get that family voice. And you do hear, that communication piece coming up, as well as suggestions within the Maternal Mortality Review Committee around, provider training, bias. It's a really rich area. So I would just add, both by improving current programming, adding programming, and getting the voices of lived experience in the recommendations. And community-based organizations can take these recommendations in that report and, advocate for policy in a way the state employees can't, for ones that resonate with the mission and are explicitly disparity focused, if helpful.
Riley. Oh, I can't see the participant, so.
Let's
Chief
see. Yeah,
said
it looks like we have a
someone's
raised hand. Yeah.
Someone's hand has been up for a while. That's a great
Yeah.
name, Riley.
Thank you. Hi. So it kind of, I was trying to word this question as people were talking, but in the last couple of years, I know doulas have been like coming like established a lot more. And I know from like acquaintances and things like that, people will just say like, oh, I'm a doula, but like, are you? Like, is there a difference between like when you go through the certification and like
Yes.
just calling yourself a doula? Like, what are the differences? Like,
Yes, that's a great question.
That's a
It was
good
in the
question.
chat also. It's unregulated. So doula work is unregulated, which we touched on, but what does that mean? Like, you know, are you going to ask me for my driver's license and my doula card? You could, I have it. There are certification courses that I would say, I don't know how to say different, Tiara, higher quality. They're asking for more. There's more education, there's more hands-on, there's more one-on-one work with the instructor. It should be a very intense class. Like for TRICARE only accepts 5 doula certifications, and I didn't have one of their 5, so I went back and took one years after not needing it. And, you know, I had to document 3 births and have the OB sign off and the midwife and a nurse, both of them, the OB and the nurse. It was pretty intense. So a quality education will be a certification process where you have to complete a certain amount to get through. Natalie Powell is here from the Nevada Certification Board, and she spearheaded with the Doula Co-op of Nevada, and of course I'm on their board, Medicaid providers. So Medicaid providers are held at a different standard. We're being licensed by a government agency. So on the Nevada Certification Board website, you have to go through that process to become a Medicaid provider. What that will tell you is that if you're hiring a doula who is a Medicaid provider, they have gone through all of that. We have to take HIPAA, trauma-informed consent, cultural competency, CPR, first aid, and we have to renew every 2 years with 20 CEU credits. So it's a much, much more involved certification or process to go through the Nevada Certification Board and be a Medicaid provider. So there are huge differences in levels. And I think just asking where people, if you're interviewing doulas, ask them where they got trained, how many births they've attended,
what kind of training they've done.
what kind, if
It's
they
so
work in the
important those
hospital.
interviews. Right.
The other thing that Tiara mentioned earlier is that we also have the Doula Access Program at Renown Hospital that the Doula Co-op of Nevada spearheaded. They brought that program to life. And in that, we are volunteers for the hospital, but we are considered nurse extensions. And doulas who have gone through that have gone through a different level of training too. And you can be a Medicaid provider not through DAP or vice versa, but you're just adding more and more on to kind of the credentialing process that you've gone through.
Yeah. And I want to add, because you said, it was in the chat, like someone said, how exactly, and then I know Janet is up next with her hand up. How does someone become a doula? It's really up to the individual doula themselves, just to answer that plainly. There is, I don't even know the total number now, amount of trainings available. But again, like Jen was saying, in that interview, families need to make sure that they're asking a lot of questions. And I mean, doulas also will be providing you with information. I give people the full rundown, as Jen said, but when working with families in person, I don't necessarily break out my certificates and the many trainings. And then we just read a lot. We read so many. There's also that side of training that's unofficial. We read a lot because, as Jen said, it's unregulated. So like every time something comes up, I'm like, oh, okay, here it is. Like, let me read this. Or we're sharing books, we're sharing articles, studies, and so on. So Jen,
I see that.
up?
And again, I just, sorry to jump in here, but Emily has been good enough to drop a link for the Nevada Certification Board birth doula requirements. So for anyone who's interested, click on that link and take a look at it.
Yes, thank you.
Janet, you said you had a question. Go ahead.
Yes,
Janet.
I actually had a couple, and it kind of ties into first what Vicki was speaking of, and then also with Jen and Tiara were speaking of. We all know that Black women are dying from childbirth at disproportionately higher rates than their white counterparts. What I wanted to hear a little bit more about how what are some of the short-term and long-term implications, impacts that doulas can have on Black women's physical, mental, and spiritual well-being? Can you guys speak to that a little bit? I know you talked about it somewhat.
Yeah, of course. You said, what are some of the implication? What
What are
Implications
some of
and
the short-term
Implications.
and long-term
Implications.
implications and impacts that doulas can have on Black women's physical, mental, and spiritual well-being?
Yeah, I think it goes back to when we were talking about like how we provide care for them, right? Opening up the pool and training up and building up more culturally competent doulas, and more specifically, more Black doulas. We don't have large numbers in Northern Nevada, or really in Southern yet, that we've uncovered. And it really depends on how we approach their care, and how we directly impact them. What was the second
thank
part
you
of the
for
question?
that. The other half of, and I'm sorry, you guys, I did have
No,
a
you're
two-part
good.
question
There was
here.
a second part I wanted to make sure I answered.
Yeah.
And I lost
I
it.
just wanted to ask, when we're, as we talk, I'm sure Pat in her introduction noted that, our goal here at the at the NAACP, because it's a national goal, not just this local goal, is to call attention to Black maternal health and issue a call to action to eliminate poor pregnancy, birth, and postpartum outcomes for Black moms and babies, so we could stop the needless deaths of Black women here in the United States and in Nevada. So our aim is to change the narrative, not only around doulas and midwifery, but addressing the stigmas and increasing their visibility, but also addressing some of the systemic racism that exists, that causes our healthcare systems to be the way they are. Yeah. So I want to know how you guys feel about, and are you utilizing evidence-based data to track the equitable distribution of resources to address this very serious problem? And how should we be holding organizations like yours accountable to creating and implementing programs that are community-driven, using measurable equity strategies that demonstrate progress in reducing maternal mortality rates in our state?
Yeah, no, and I'm glad you mentioned the healthcare system, because we know how doulas can support, right? We had said it several times on this call. I think that addressing the root cause, which is in the medical systems, because doulas can't operate in definitives. We can't say that we definitely will eliminate this, or we're going to cut this by this number or that. I think that helping organizations, various doula organizations, foster relationships with those medical systems is step one. This is my opinion. And making sure that we have access and that we get in there, because that's a big part of it. Like you said, the system is not set up to be successful for Black women. It is what it is. It's not set up for us to be successful in those settings. It's not set up for us to be heard in those settings. One thing I used to say all the time, and then I had to stop, was to my families, was find a Black doctor, find a Black care provider. And that's no longer like, it doesn't feel comfortable for me to say that, because they're raised up and trained up in that system that is rooted in racism and is rooted in these medical bias. And so I stopped saying that to my families and realized, like, in my work as a doula, and I know we talked about this as an organization with the co-op, is we have to build relationships with the nurses associations, the Black nurses associations. We have to build relationships with these OBGYNs, because at the end of the day, they're the ones that are handling that care that results in a positive or a negative outcome.
I think also, I mean, we talked about education. It's the doulas becoming educated ourselves and then passing that on. And during Black Maternal Health Week, I spoke at an in-person event here, and it was really interesting in our Q&A at that point, all the women talking about generationally how they were trained up to behave with medical professionals. And a lot of what Tiara was saying was that we're empowering our clients, right? We're inspiring confidence and we're supporting them. So we're right there We're right there with them, but we're empowering them to have a voice. And it was really fascinating that if you've been taught, one of the women said, you know, my grandma beat it into me. You don't ever let them see you cry. You don't ever make a sound. You don't ever bring attention to yourself. And so I think some of this goes both ways. It's teaching the woman who's pregnant that she can have a voice, that she can have a conversation, that she is an advocate for herself, that she should walk in confidence in what she wants, that she should become educated, and she should not be afraid to speak out. And so it's harder for me to speak on that because I'm not coming from that generational background personally, but it was really fascinating when some of these women stood up and took accountability for themselves, and how the second they got pregnant, they took a back seat to every conversation with a medical professional, and that should not be allowed. And so kind of not on our watch, you know, when women have doulas in general, we're educating and empowering them, and then we are supporting them and we're staying by their side. So I think continuing to do that, we know that doulas can decrease a lot of the rates that are happening, and we just want to continue that. We want to continue that trend.
Yeah.
And then
Well, we're
Patricia-
cruising up. Yeah, that's okay. We're cruising up on 7 o'clock. So I'm going to be that person that's the timekeeper, because we're losing folks. And I want folks to be cognizant that we do have a post survey that we'd like folks to go to. That link. It's in the chat. And, you know, tell us how we did on this webinar this evening. Tell us if there's other topics that you'd like us to talk about in terms of Black maternal health, or just African-American health in general. But we do want to make sure, because I see folks were hopping off, and so we want to, like I said, it's 7:01 now, so we want to be observant of your time as well.
Thank you, Patricia. I know we get lost in Q&A.
Yes, Q&A, and that's great. It was a great, you know, robust conversation. Yeah, and my questions kind of sort of were answered. Janet said one of them as well. So yeah. You know, I just would like to see something like the doulas become somewhat mainstream, and
Exactly.
Yes. Especially in the African American, you know, population. I've had 4 kids, and I've had 4 C-sections, right? So if that tells you anything.
If I can add, just in, you know, because there were a lot of questions like, what are we going to do in the future? What can we do? Partnering with organizations like the Doula Co-op, and there are many others, and we all work together behind the scenes, outwardly facing. And so connecting with organizations that, you know, are focused on building the doula workforce. There's doula agencies. So really connecting with them. If you're an organization that's on the call today and you're wondering, like, how can we support or how can we build up? It's really what Emily put in the chat. I love that, like saying, you know, we just need to connect and support each other through this.
Wow. Thank you. Thank you. Thank you. Thank you.
Keep having these conversations.
I suspect that this is just a start of our collaboration and our future efforts. This is just very powerful. Thank you, Jen. Thank you, Tara. Thank you, Vicky. I'm just overwhelmed. I mean, my interest started, believe it or not, when I heard about Serena Williams, and I remember she said, "Nobody listened."
That's it. Nobody listens.
And as powerful and as wealthy as she is, she almost died because no one listened. And when I hear that 80% of these maternal deaths are preventable, then I think that we as men should be allies.
Yep.
Should be fully supportive of these efforts, so that the women that we love, the people that we love, are not put in jeopardy needlessly. So so again, on a personal level, thank you so much. To the audience, are there any other questions, anything that you would like to have our presenters address?
And we're going to send out our contact info afterwards to the attendees. Okay, perfect.
That is correct. We're going to have the survey at the end. And Brian, has it already been posted?
There is in the chat. The link to the survey is also in the chat as well.
Okay.
Where?
Yeah.
So you can.
Yeah.
Please take
great.
the survey.
Please take the
Please,
survey.
please.
Yeah.
And then
We're interested in how we can help further.
For anybody who misses it, we'll also send an email out tomorrow with contact information and a link for the survey as well.
Thank you, Gabby. All right, then folks, thank you again for attending. I thought the information was incredible, very enlightening, and we look forward to the next one.
Yes, thank you all for
So-
being here this evening. Thank you for the presenters, and we appreciate you all.
Have a
Thank
great
you.
evening.
Have a good one. Thank you.
All right,
Thank you.
Bye-bye.